Hi, I'm Ginille, Cosmetic Nurse Practitioner since 2013. I've got offices in Los Angeles and Las Vegas. In our offices, we focus on natural looking aesthetics, treating all skin types and tones safely. We've got natural filler, traditional filler, Botox, a lot of skin treatments, hair health treatments, weight loss and wellness. So today, feel free to jump in, ask me any of your aesthetic questions. I can talk to you about different patients and treatments they have done. Hey guys, thanks so much for jumping in. If you want to come on in, and you can also, we can talk one-on-one where we can go through your assessment and talk through your questions. So sometimes people will do that, and we'll do a little consult here on live. Okay, I know I probably should have said that I was going on live. I didn't know what time I was going to do today, but this is me prior to having any aesthetic treatments. This is 10 years ago. I'm 38. In this picture, I was 28 and I had my first kid. He's now 11. And after breastfeeding, I felt very sunken underneath my eyes. I was losing volume through my temples, my eyes, my cheeks. I felt happy, but I just felt like I looked tired. I didn't like the way that I looked so tired. I didn't want to look like I was tired, like I was kind of having a hard time. So that is when I started getting aesthetic treatments. At that point, I'd already been injecting as a cosmetic injector for a few years. I just hadn't really done any treatments. I was thinking that, that's for when I'm older, like, no, Black don't crack, Asian don't raisin, like I don't need that. However, I ended up loving it. So, hey, Sari, hope you're doing so great today. Sari and I used to work together, guys. She's also an amazing PA injector. Okay, so in this picture, I ended up doing filler underneath my eyes. I ended up getting cheek filler. I had temple filler and then filler into my chin as well. Let me see. Oh, I don't think I set up before and afters of that. I mean, you can see my face here, but this is me 10 years ago prior to having anything. I have 3 babies now. I'm still breastfeeding this baby that is 2. And because I'm breastfeeding, I can't do filler. And so I've been doing the natural filler. So a lot of people are like, what is that? Natural filler is made entirely from your own blood. So we draw blood from your arm, we spin it in the centrifuge. It separates out your growth factors, your stem cells, and then we heat that and cool it. So it makes a gel and we can inject that. So the past couple of years since I've been breastfeeding, I've been using that underneath my eyes, into my temples, smile lines, chin. When I very first did it, I was like, oh, this doesn't do anything. I am used to seeing immediate results with filler. And so I was like, this doesn't do anything. And I really brought this treatment on because a lot of our patients were asking for it. They were like, can you do the natural one? Can you do PRF? Can you? So I was like, okay. For people that want a natural treatment, I'll have it. But over time, I was like, whoa, I don't look so sunken. I don't look so hollow. Like I haven't had filler for 3 years. I honestly don't know if I'm going to go back to filler. I love filler, guys. Like I love it. I do this for work. If you need that immediate result, if you want something more structured, more defined, like I don't want to say guarantee, but I have different fillers I can choose from depending on you and how thick your skin is and what we're trying to do. So I can do a lot with filler. However, I'm like, if you're really thinking preventative or maintenance, I really encourage you to check out the natural filler. So again, that one is made entirely from your own blood. Nothing else is mixed inside of it. You're going to get new collagen wherever we inject this over time. So it's gradual. Yeah. Hey, Patty, she says, from DC, how do I handle long distance patients? So every day I'm in clinic, I see patients that fly from out of state, out of the country, I work primarily in Los Angeles, but we also have clinic in Las Vegas. I was in Las Vegas yesterday seeing patients, but our patients come in, they got their little suitcases. So what we do before that is we do a consult, and I consult, even if you're in LA, like I like to do the virtual consults. This is where, or my team, we go through your questions, your goals, tips on what to expect, how to prep for treatments. We start building out your treatment plan during that virtual consult. So sometimes people will do virtual consults like on here, they'll jump on and we'll talk. Can't be like as thorough as when we get on one-to-one. Like on our virtual ones, but it's just time for me to like get a little bit deeper into like, what treatments have you tried? What are your concerns? What are your goals? All the questions you have. I ask a lot about your medical history, any medical conditions. So then I can say, make sure like, oh, your timeline as well. What do you do for work? Or can you rebruise? All the things. trying to make sure that these treatments are going to fit in with you and your lifestyle and what's going on. So that is, hey Kay, I hope you're doing good. That is really important. And so then when the patients come in, we've already gone through, like I've already written out a treatment plan. We send out pricing so you have an idea. We send out, if you want to do financing, we send that out so you can like pre-qualify. And then we just make sure that the timing is right for when we're doing your appointment. It's not, 3 days before your wedding. It's not 3 days before your birthday celebration. Like we want to make sure we have enough time. And then you start prepping at home, avoiding blood thinners, avoiding alcohol, taking arnica, eating pineapple. If we're doing skin treatments, which most of the patients are, hey, Nikki, thank you so much. Hearts, hearts. If we're doing skin treatments, that we're stopping active ingredients, we're avoiding the sun, making sure your skin is not feeling irritated. So we're not going to further irritate it with a skin treatment. So it really gives us time to like prep and get ready for you coming in. And again, even if you're in LA, I encourage you to do the virtual consult. It just makes you best prepared for your treatment. Okay, if you have questions, please let me know. Thank you guys for the hearts and thanks so much for coming in. But yes, for Patty, we can totally set up some time to virtual consult. If you go at the top of my page, you can click the thing. We just switched websites. We just switched medical records. Like we did a bunch of changes this past week. So if there's things that are like, Ginille, you need to look at this, let me know. But you can book your virtual consults there. If you know for sure, because a lot of people are like, I've been watching you for 5 years. Like I've been making videos every day, guys, for 5 years, like multiple videos. Like, I already know, we've talked about it. Like, I know I can bruise. I know I can swell. I've cleared my calendar. This is when I'm going to be in LA. This is whatever. Like, I know I want the natural filler. I know this skin treatment. I still might be like, hey, let me know your medical conditions. Hey, send me some photos. I want to make sure this is right. But some people are just like, I'm going to book the thing. If you already know what you want 100% and you've studied and you can book it on there as well. So we tried to make booking really seamless. Okay, let me see. Hey, I'm in LA. I've been looking for a person of color esthetician. I've been seeing your pages for years too. Oh, thank you so much. I've been on here. I started it in I think like 2019, but I really started doing TikTok in, I think 2020 when it was shut down. And that is where I started finding like, oh, like who am I really serving on here? And that was nice. I got to see a lot of people of color, which I love. And in our office, we treat all skin types, all skin tones. I can go through patient pictures. I set them up today hey, Patty, she said she's in, so that's good. Of different patients that we see in our office. And I can talk through the treatments that we've done. And if you have questions, please feel free to let me know. Referral in San Jose, I don't know off the top of my head, but let me know if you have other questions. Let me show you some of our people. So like I said, we see all skin types, all skin tones. Let me see if I can move this over. And then I'm going to try to do this where I don't make myself bigger. Oh, yes. Okay, cool. Sometimes it makes me super big. Okay. A lot of what we focus on is facial balancing. We see men, we see women, we see all ages. Our goal is to make sure that you look like yourself. You look refreshed. Nobody can clock what you did. That's the goal. I don't want it looking overdone. I have been with some of these people my entire career. I've been doing this almost 13 years, and the people just like over time, they just keep like aging backwards. They still look like themselves, very true to themselves, but it's aging backwards. And the way that the team and I inject, when we're injecting, we're really thinking about what's going on underneath the skin. Where are fat pads separating? Where are we losing bone? So that's where we're injecting. We're not just here to like chase a line. Like, oh, you might just see like, I got the smile line. A lot of people are like, I got the smile line overnight. I never had this and now I have it. I'm like, okay. But realistically, like this is happening over time. We're losing bone here. We're like bone is sinking here. Fat pads are separating. So that's how we inject so that it doesn't look weird. It still looks like you. That is always the goal. But again, like if you just look at the after photos of these people. So if you look at the one, I don't know if that's your left or right, but the one that has the logo on it, like you wouldn't think these people walking around have done stuff. So she came in, she'd never done anything. Freaking beautiful girl, and like her heart is even better than her outer beauty. But for her, she came in, she's like, I've never done anything, but I feel like my side profile, like my lips kind of overpower. She's like, I feel like it kind of looks ducky. So she's like, I just feel like I need some balance. So for her, we did some filler into her chin to elongate her jawline and help balance. Again, she has more fullness in her mid face. Chin is a little bit shorter, like set back some. And so it's just balance. but it looks like her. You wouldn't think she's done anything. That's the goal. Here's another one similar. Let's look at the after. If you saw this girl walking down the street, you wouldn't think she's done Botox and filler, but she's done stuff and she looks natural, and that's the intent. Another one, you're trying to elongate the jawline, camouflage some of the fullness underneath, making the jawline look more defined, and then balancing these upper and lower face proportions. Okay, and we do men, we do women, we do all the ages. That's really cool. Noses, this is another thing, you wouldn't think this person did nose filler. So she came in, she was just like, I don't like this bump on my nose. A lot of people, I'm like, nobody's seeing that bump. But for that person, they're like, this is what I see. I don't like it. I don't feel as confident taking pictures from the side. And so with nose filler, we can camouflage a bump. We can lift the tip of the nose. We can make things just look straighter. We can make it from the front look like a highlight, a little bit more contoured. We can prevent it from curling down when you smile and the tip goes upwards. So yeah, that's the goal. She just wanted hers to be straight. And I tell people for the nose, I say 1.5 to 2 years. Most people get longer out of it. That patient had come back to me 2 years later. She's like, it's still straight, but do I need to do more? I'm like, no, if it's already still straight, like, let's not do it. So she came in, she's like, my family won't let me get a nose job. A nose job, like, it's whole surgery. And then you have to wait a while to see the full results of it. You have to wait, 6 to 12 months to see the full results from swelling. But with nose filler, you can get instant results. So this is after we did 3 sessions. A lot of times I just do 2. She was like, I really want this as straight as you can get it. And I mean, yeah, it looks like her. Like, you just look super straight, but that's, we can do a lot of things with filler. Here it is from the front. People will be like, can you make it look super tight? Like, I can't make it really tight. What we can do is create a highlight down the center so it looks a little bit more defined. The girls will tell me, oh, it looks like I have a highlighter on. Oh, I don't have to try to contour it so much. Okay, do I recommend smile line filler? So when we talk smile lines, I tell patients like a few things to keep in mind. I'm like, a lot of people will say like, just this line bothers me, but I'm like, what is this line caused from? I made a video on this the other day. I don't know if I've edited it yet. So this line is caused from us losing volume through our upper and mid face. So fat pads start to separate, they start to sink down. So the cheeks look a little bit lower, the lines look deeper. And so that's when we can talk about, hey, not just doing smile lines, but are we putting some volume through the mid face to help this look lifted and help the light reflect off the face higher? Actually, you can kind of see it on this patient. Instead of her highlight, most of the highlight is here on her cheeks in the before, and then after, her cheeks look pulled up. So without surgery, just doing some filler in through the mid face, it's making like the highlight look up. Everything we do is kind of about like lights and shadows. We don't want it to be overfilled, but we're trying to change the light so things can look pulled back. It's not actually pulling you back the way surgery can. So that's something to keep in mind. So I will say yes for smile lines if you have good volume in the mid face, if this is not saggy. Like, I have a good story for you guys. I had a patient, she came in from Dallas or Houston, and she was like, Ginille, I know what you're saying, like, but only the smile line bothers me. I don't see what you're talking about in the cheeks. It's not this patient, somebody else. And I said, okay. She was like, I just want you to do the smile lines. I was like, ma'am, like, this is not the way, but okay, I'll do smile lines. We softened the smile lines. The lines were softened, but this was still down. So she was like, why does my face still look sad? She's like, I see the line is gone, but why is the face sad? I was like, ma'am, because you have lost volume through these other parts. She's like, okay, do what you're saying. So we did some filler through here to make the highlight up. And after, she's like, I get it. Like, I can see it now. It looks pulled back. She's like, that's the whole goal. Other thing with smile lines, you guys want to keep in mind, we don't want to try to get them all the way gone. So some people will be like, I don't want any line here at all. I'm like, guys, it's not going to be a filter. Like, we're going to still have movement of our face. We're going to still smile. We're going to animate. If I get this line all the way gone, which I can do, it's going to look puffy, and you don't want that. So she is like a really great one too. Soften the line. Made the highlight on the lateral part of the cheek, at the corners of the mouth as well, did some into her chin, and then along the jawline to balance her features. She came in and she wanted lips like once or twice and some Botox. I was like, Sergio, girl, like, this is really cool. And this is really great because she does document her journey, and she is like shared, and we've been together for, I think, since like 21 maybe. And I feel like she looks like younger and fresher and hotter like now that she's even older, but by doing some of these treatments. So similar thing, trying to create the highlight so cheeks look pulled up, softening smile lines, not trying to get them all the way gone, but we're not just focus on smile lines, guys. Remember, I did this because if I just did our smile line and then this is down, it's going to look a little off. Also, people will just do smile lines and then they forget these lines down the corners of their mouth. So then this looks down, but this looks puffed out. It looks weird. You don't want to do that. Like, you want to consider the full face. Injectors are considering the full face. So that's something you want to be mindful of when you're choosing the injector. Other thing for her that we did was we couldn't just keep doing lips. So I was like, you need some support in the lower face. So we did some into the chin and then this pre-jowl sulcus. So this area before this jowl fat pad, I just posted some videos on that to camouflage the jowls. Jowls, these fat pads keep sinking. So over time, our jaw lines will start to kind of look, you can see like even me a little dip will get more and more as we get older. So I'm just trying to like camouflage the appearance of them. You can totally get surgery that can pull you back. Not everybody wants to do surgery. Not everybody's a candidate for surgery. I think all of these things can have the right place. So I talked to you about what we can do non-surgically. I'll tell you limitations with it. Yeah. I have high cheekbones but naturally sunken eyes. So yes, high cheekbones. So then you probably don't need any through your mid-face, but just a little too softened underneath the eyes. Yeah, a lot of people as we get older, they got sunken eyes, plus this line extends through their cheek as well. So then they got like a crease through their cheek as well. And so that's when I tell people, I'm like, we can't just have, filled up eyes and then sunken cheeks, or that'll be weird. It just looks off. And like a lot of people wouldn't know exactly what looks off but they just think like that person did Botox. They look bad. And I'm like, dang, like it doesn't have to look like that. I think a lot of people, it's just kind of like incomplete work or overfilled work, which we don't want. So for sunken eyes, we can do a few things. We can do, my phone's frozen? Okay, there we go. For sunken eyes, we can camouflage fat pads. We can use filler or the natural filler to lift an area so things can look brighter, minimize the appearance of that hollowness and that sunkenness. And people will do it at different ages. I think she was in her late 20s or very early 30s, but you can still see like losing some of that volume through there. So that's where we'll put filler or the natural filler to help light to reflect off the face a little bit brighter and camouflage fat pad. A lot of people will come in for eyes. I'm like, guys, don't just see anybody random when you're doing your under eyes. You got to see somebody that specializes in this area. If it's not done right, it looks bad. Or if they're just doing here and then the cheeks are saggy, it looks incomplete. That looks bad. You don't want that. So here's somebody young, like beautiful. I'm trying to show you different ages. I'm trying to show you different faces so you can see young. She just finished law school and she's just like, I feel like I look a little tired. So we did a little bit. She's poked up in she's a little poked up here, but it just lifts the skin, camouflages the fat pads, makes things look a little bit brighter. It won't change the color of the skin, but a lot of people will be like, oh, it doesn't look so dark because it's not catching a shadow from being sunk in. If it's still pigmented, people's like, oh, now if I use my concealer actually works. So user 1, 2, 3, 4, I said, what can I do for dark under eyes? If it's hollow or sunken, you can do filler or the natural filler to lift the area. If it's lifted, so you can see here in her before, like she still has some darkness underneath, but it doesn't have like as deep of a shadow because it doesn't look as dark because it doesn't have that shadow from being sunk in. People say the under eyes are like hers. Yeah. So this, was done without surgery. Like she's able to get those results. I have people come back at 6 to 8 weeks after we do it to just reassess, make sure everything looks fresh. Should I do any little minor tweaks? But I don't want to ever overfill. So I tell people, I'm like, do some, let it settle. It's easy to add more. We don't want to overdo. That's a big part. Natural filler like PRF. Somebody asked, yes, you can, this PRF, but we take that and we heat it and cool it. So it makes a gel. When we heat it and cool it, it's thicker. And so it gets a little bit more of an immediate lift, but that's not really the whole purpose of it. The heating holds those growth factors and stem cells in your skin longer than if we didn't heat it. So then the growth factors and stem cells are what makes your body make new collagen. If we did regular PRF, you get the growth factor, exposure for like a few weeks. When we heat it and cool it, that gel, it hangs in the skin, the growth factors for up to a few months. So that's more time for your body to make collagen. Okay, I'm going to try to make sure I'm hitting these questions. I'm going to go back. My face is very animated. I can still smile and do expressive. My face is very animated. Can I still smile and do expressive faces if I do filler? Yes, if you're not overfilling. Like all these people, guys, they make videos. I have videos of probably all these people that I'm showing because a lot of people will just document and share, but like they can move and like move their faces and smile and all the things. That's the goal. You don't want to be overfilled. That's the biggest thing. And I just tell them, like, don't overfill it because that'll look weird. But I'm just trying to click through, and I can talk through each of these people, like if you want, and their stories and what they did and why they did it and how they look fresh after. But yeah, I'm not trying to have frozen puffy faces. When people can't move, they just like have done so much to their face. Like, we're not trying to do that, guys. Like, that's not it. That's not the goal. We wanted to look natural. Was this tear trough filler? It was probably tear trough filler. I was talking about eyes a little bit. Somebody had said, which one lasts the longest, Laya? So when you're talking about filler or the natural filler. So traditional filler give you immediate results. I tell people 1.5 to 2 years. A lot of people get longer out of it. Natural filler, the immediate little lift you'll see for a few weeks. The collagen, the new collagen, the whole purpose of this is not that immediate lift, guys. I'm looking for a new collagen with this. That new collagen can last for years. I will say, the healthier you are, the better the outcome. The younger you are, the better your body can make new collagen. So I'm like, if you're telling me you're smoking and drinking and drugging and doing all these things and poor diet, all that, I'm like, your body probably can't really make that much collagen. So it's something to keep in mind when you're getting these treatments. If you're getting the natural one, I'm just like, I want you to be healthy. The better choices you can make, the better your outcomes, the better your body can make new collagen and hold on to that collagen. So it's really going to depend on the patient. Okay. Somebody, Bubbles, said, read my comment. I'm trying to find it. If you can also hit it up again, because I'm trying to scroll and see if I can find it. Hey, B-Fly LA. I hope you're doing so well, girl. I love you. What can I do? We talked about dark under eyes. I'm 39 and my under eyes are so puffy. What should I do? So if you get puffy under your eyes, like if it swells up and down, if you cry a lot, if you've got bad allergies, you wake up and you're like, my eyes are puffy every day, don't do filler. Don't do filler. Traditional filler binds water and you don't want that. It will get puffier. Like it'll puff up with you every day. If you don't get puffy, you can do filler. Traditional filler gives you the immediate result. The natural filler, you're safe to do if you get puffy or if you don't get puffy. That's the one that's made from your own blood. If you're like this, like for her, I told her, I was like, no, do surgery. Like, she's like, no, I'm not. I was like, I can't take that fat pad away. Like, I know I can't get it away. She's like, I'm not. Like, do what you can do. I'll be happy with what you can do. I'm tired of looking at this. She didn't get puffy. She doesn't cry. She doesn't have bad allergies. So for her, we did traditional filler. I went underneath the fat pad with filler and I brought all that skin up to camouflage it. We also did a little through her cheeks. Oh, she has beautiful selfies. I need to go through like my selfie file and like place the pictures up too, because she looks so hot. Like, she looks so good. And she's just like, I feel way more confident. She was she's like in her 50s. And it just like hides that. She's like, I will not let this wear off. So if you get puffy, you can do, thank you so much, Laura. If you get puffy, you can do the natural filler. You can do, if you're like this and you want that fat pad gone or tightened, taken away, I will say, hey, do a surgical consult. And then you just decide what you want to do. I always want you to make informed decisions, never rush decisions. So I'm like, get all your info. If they're like, should I do it? I'm like, if you don't know, I'm like, I'm not making that decision. Let's talk through like limitations. Let's talk about expectations. Let's talk about like, what do you want? How soon do you need to see it? All of those things. But I'm not going to be like, yeah, do it. That's not my thing. Okay, Bubbles, I want it, but don't know if it'll look good on me. Bubbles, what did you say you wanted? Let me see if there's I have high cheekbones, but naturally sunken eyes. Oh yeah, we talked about that. Do you think it looks good on everyone though? Sunken big eyes is very common in the Middle East and East Africa. It just depends on the face. Like as you see again, I'm going to click through these patients that I've seen. These are just some of the patients, guys. I've been doing this since 2013. And like this is my team too. Like the patients we see, beautiful. She was working on her jawline. She wanted more definition here. We dissolve fat underneath here. And then we straighten the jawline and into the chin. So I'm just going to flip through like all of these faces, guys. I'm not trying to make every face look the same. So if you see, I see all skin types, all skin tones. We see women, we see men, we see young, we see old, we see everybody. Like that's the goal. I treat everybody, my team, we treat everybody. We love everybody. We want you to look fresh. We want you to look natural, your best self. So I can't just be like, yes, this is going to look great on you. Especially I'm only reading your comment bubble. So I don't know. I have to like see your face and I have to talk to you about your goals. Even, some people have a bump on their nose and I'm like, do you want to take that away? Like, like even for me, like probably the only spot I haven't done is my nose, because I'm like, oh, for me, it looks like my kid's nose and I got 3 kids and I'm like, okay, I'll keep it because it reminds me of them. So I'm not here to morph everyone's face into the same thing. That's never it. We want you to look like you. We want you to look fresh. We're really talking to you about your goals, understanding what you're trying to do. I have worked with people that are like, I'm transitioning from a woman to a man, from a man to a woman. And so this is what I want. Or I don't really know. I kind of want to be in between. Like, I don't really want to identify as a man or a woman. Like, what can we do? So we have to talk. And we have to look at your face, and we have to look at how you're aging, and we have to talk about your lifestyle and your goals and what you do for work. Because I will walk into one room and I'll treat a nun, and then the next room is a sex worker. Like, we see everybody. And this is why when we do our consults, everything is going to be really personalized to you to make sure you look fresh, that we're meeting your goals. Some people might want something a little bit more dramatic, a little bit less dramatic. We just have to like talk it all through. Okay, Bubbles, I hope that helps. I was trying to scroll back and make sure I got your thing. Okay, what do you suggest for neck aging? Don't really want Botox there. Botox does help tighten these neck bands. Simple things you can do. Your sunscreen. Bring your skincare all the way down. So your sunscreen, your retinoid, bring it all the way down. Moisturize. You can do your microneedling for texture. You can do your chemical peels, your laser, any of your skin treatments for the skin, texture, hydration. Like, you can do all of those things. Skin cell turnover, that is easy. But like, the easiest thing you can do is your sunscreen and doing your skincare, your retinoid at home. In office, the skin treatments, if you don't, and Botox does work really well for these, to tighten these and kind of like tighten along the jawline. If you don't want that, you can do dilute radius. And I did not set one of those photos up, but dilute radius. Radius is a calcium-based filler. When we dilute it, it mimics bone, but when we dilute it down, you're getting collagen benefit. So you can inject that into the neck and it will help improve the texture. People are like, it just feels like my neck is tighter. So with dilute radius. Okay. Does Botox work for under eye bags? No. Botox underneath the eye. So see, when I smile, I got like these little lines. It can do like, you can only put a little bit of Botox underneath the eyes, like a couple units. If you do too much Botox underneath here, it'll pull it down. That's not going to look good. I'm always thinking about if we do something like what could not look right. Like, I want to avoid that. When we're doing Botox, we're thinking about how Botox works on relaxing the muscles from flexing so hard. So we don't want to stop this muscle from flexing too hard. It'll pull down. That'll not look good. But if you do a little bit, it'll soften. I mean, like, it's like these little lines underneath where they don't bunch up so much. If it's under eye bags that you want to be taken away, that's where I'll say, hey, do a surgical consult. Or I can show you a few eyes. I was flipping through these earlier. We can camouflage the eye bags with filler or the natural filler. So there's that. I think I had somebody else. She was here. I think I've got a lot of them. So here's some different ages, some different faces with under eye bags. So this was after she came back she did one session and then she came back at her 6 to 8 week mark. And so then we did a little bit more to like hide the bag. I tell people, I'm like, I can't take it away. If you want the bag gone, surgery. This girl was so happy though. We got a video of her and somebody said, can I move my face after? And she's like talking through it and she's showing it and she's so happy. She's like, my family was so happy for me. She's like, I just feel like I look way more rested. Like, I saw it instantly. You could bruise, you could swell, whatever. She's like, I didn't even care about that. She's like, I could see it instantly. Like, I just don't look so tired. And, I really don't want to have surgery. She's young. She's like, I don't want to have surgery. Like, I'm trying to do what I can to just hide the fat pad. Yes, I know it's still there, but it doesn't look as apparent, and she's happy. For her, she did filler. You can do filler or natural filler. Okay, let me see if there are ones that I have missed. Location. And we've got 3 offices. So JASI Skin and Wellness, we just switched the name. So if you're searching that, you might be like, what is this? I can't find it. But it's been under my name since 21. So Ginille Beauty Aesthetics or JASI Skin and Wellness if you're searching online. 2 in Los Angeles. We've got Mar Vista, we've got Torrance, and then 1 in Las Vegas, and we're on the Summerlin side. And we've got teams in all of them. I see patients in all of them. I was in Vegas last night. I got my teams are seeing patients, even though it's raining right now, in Torrance and National and Mar Vista today. I'm seeing patients in LA all next week. So we go to all of them and we do all the treatments amongst all the offices. We see all skin types, all skin tones amongst all the offices. All of the team members have the same philosophy and the same approach to natural looking aesthetics and treating all skin types and tones, getting safe results and natural looking results. The girls are excellent. Like, I would never have somebody that wasn't on our team. Okay. Does chemical peel help thigh lift scars or post-surgical scars? Yes. We might be combining that with the laser and or microneedling, just depending on the scar. So that was for Ray. Okay, let me see these other ones. Okay, I'm going to Vegas in 2027. Yes, we're there. I'm in Redondo, Torrance. Oh, we got an office in Torrance. Like, I'm there all the time. I live in the South Bay, so like I'll even go there and like film, you know, if I was doing like my admin day. But we're there, and it's great. Like, it's a great team. I've been there for a while now. Okay, we talked about neck aging. Okay. And so I will flip through a few more of these. And if you have questions, I can talk to you really quick as I go through them, and I'll tell you what the patients did. So for her, she wanted to make her jawline more defined. She wanted to get rid of fullness underneath her jaw. So we did Kybella. Kybella is a permanent fat dissolver. It takes multiple vials, multiple sessions. This is not overnight, guys. I tell people, I'm like, if you do want surgery, just get that sucked out. This is going to take a while. But she did that. And then we went and defined her jawline with filler afterwards. If I just try to do definition, she wouldn't have had the fullness, you know, gone. So it can look more defined when we got rid of the fullness. I'm going to make sure I'm not missing what are my favorite vitamin C serums? Our JASI line, guys. That's all I use. That's what we recommend to our patients. Best way to lighten freckles, stay out of the sun. Use your sunscreen, and then your vitamin C helps with brightening, and then Aerolase laser, BioRePeel chemical peel, skin pen microneedling. So in our office, we have a skin membership. So we do a lot of skin. Like, I know I'm talking about like Botox, but like we do a lot of skin, and that is like such a big, and we do a hair health program too, but like skin is such a big focus of ours. And I say that because, again, we treat all skin types, all skin tones. Not all of these treatments are created equally. Not all of these treatments are created for black and brown skin. But you know, like I said, I'm seeing all skin ages, all skin types, everybody. We got to make sure the treatments that we're doing are safe for black and brown skin, and they're going to get the results. So having said that, in our office, we have a skin membership program. We take care of your skin. You come in on a monthly basis. We are going to be picking and choosing between the laser, the chemical peel, microneedling, the hydrofacial, depending on your skin's needs for that month, depending on what we're trying to do, like what your goal is. So sometimes you're like, oh, we're going to do this next month. And when they come, I'm like, oh, hold up. You didn't have these breakouts last time. I got to change the game plan up. So we're really like reading your skin and assessing your skin and developing that treatment plan specific for you. Sometimes we're stacking the treatments on the same day. So we're doing like multiple of these, 2 to 3 of the treatments, working on different layers, depending on your goals. So the skin program is excellent. We also have a Black dermatology nurse practitioner on our team. We prescribe and dispense prescription medications. We get you on the right skin regimen to do at home. It really transforms people's skin and their confidence. We do a lot of acne, a lot of dark spots, hyperpigmentation, hair removal, but just overall like skin rejuvenation, fine lines, pores, texture. Like guys, my eyes just goes to like faces. Like, I can't turn it off. I'm not ever like judging people, but my eyes just goes to like skin and highlight off the face. As soon as I walk in the door, give me 2-3 months with a person. When I walk in, I'm like, sheesh, I see your highlight on your face. I can see the way light reflects off your face. I can see the health of your skin with me just instantly walking in the door. I can tell how their skin has progressed, and the patients are like, I know, I see it. Oh, people are stopping me. I'm not wearing makeup. I've never in my life not worn makeup. I've never gotten compliments on my skin before. Those are the things that we're hearing, and it's just so like encouraging and so exciting for the patient to feel that way. I never thought my skin could be this way. Those are the things that we're hearing, and it's like really cool. They like that stuff more than the Botox and fillers. I love all of it, but like the skin, even my trainer today, I'm going to post it so he'll find it. He's amazing. And his skin looks great. 58-year-old Filipino man. He's amazing. And he was like, hey, like, I've seen your videos and I see you talk about the skin thing. And like, so what can we do for my skin? I'm like, people really care about their skin. This is the largest organ of our body. This is the first thing everyone sees. But like, people just want their skin to look nice. He's like, no, like I've struggled with stuff. Like, yeah, so we really are big on skin health. I think that is first before we're even talking about Botox filler. Again, I love Botox filler, guys. I'm an injector at heart. That's what Jesus gave me as my gift. I don't really know why. I'm like, God, this is a random talent, but okay, I trust you with it, and I'm going to do my absolute best and really try to serve and get people the best results and help them look and feel beautiful. And that's what I'm out here to do. Okay, do you think it's a bad idea to get Botox before weight loss? No. Botox before weight loss is fine. If you're thinking about filler, that's when we have to start to think like, okay, if you're going to be losing weight, This is for a lot of people right now, especially like GLP-1s, like the weight loss medications. And like they're going to start noticing volume loss under eyes and through their cheeks, the smile lines, the corners of their mouth start separating, start sinking. So that's when we're like, hey, do you want to start your filler or like your natural filler or your collagen stimulators now? Or do you want to wait? Some people are like, I've lost a few pounds. I've lost 10, 20 pounds. I'm going to lose 50, but I don't like the way I'm already seeing this sagging. Ginille, start something now. Other people are like, I want to get all the way weight loss and then see where my face lands and then do something. Other people will be like, hey, I want to start doing collagen stimulators, like in my weight loss journey, because as I'm losing weight, I want to be still making collagen. And then after that, if I need the instant lift, we can talk about filler. So this is why we gotta like consult. I have like, if you tell me one thing, you see, I can't even answer one question with like one answer, like one word, because there's so much thought that goes behind it, especially like everything is just so specific to you and your goals and your face and what's going on in your lifestyle. So I'm like, I know a lot about my people because I'm like, okay, what is going on? What she do for work? Oh, she shows up on TV. Oh, she's a principal. Oh, all these things. Oh, she still needs to be mad faced at people because of her. She's a judge, whatever. Like we know what's going on so that we can make sure that these treatments are going to fit you and your lifestyle and it's going to look natural and true to you. I got a lot to say every time. I got a lot of questions to ask every time. Okay. Let me see. I'm going to go back down. Someone said, I needed this. Is BioRePeel effective for dark knuckles? Yes. So we use a higher percentage. So first of all, sunscreen on the hands, guys. But we can use on the body a higher percentage of our BioRePeel than what we do on the face and neck. So we can do it on the body for acne. We can do it for hyperpigmentation, but it's a higher percentage TCA peel there. And still, it's not like a crazy peeling. But if you're not wearing sunscreen and getting sun protection, I don't want to do it. I just want you to waste your money. Because I'm like, if you're going to get sun on it, you're going to waste your money. Amazing. Thank you. I need this. Okay. I want to come see you. Jess. Okay. I need to move back to LA. I'm in San Francisco. Hey, honey. Yeah, I mean, that's a quick flight. Girl, I see a group of sisters from the Middle East. They come once a year. They come 7 of them deep. Like we see people and it's from TikTok. It's from social, which is so cool. But like we consult before we talk about what's going on. I see people from the Caribbean. I see people all over, definitely all over California. They will drive that day. That's why we did Vegas, because we have so many people that just drive from Vegas for that day. And a lot of our patients will go back and forth between both. The Bay is probably an area like that'd be really cool to have a spot, but I just want to make sure we're doing the right things before we're just making a bunch of clinics or anything. Okay, skin treatments would I recommend for someone with frequent breakouts? Nikki, so acne, let's do the Aerolase laser and the BioRePeel chemical peel. Aerolase laser is excellent, safe. Anything I talk about, guys, safe for all skin types, all skin tones. This doesn't have any downtime. I really love it. Give me 3 months with your skin. Like acne, we get that under control so quick with people. 2 to 3 months. So we want to work with on your, obviously, lifestyle things, diet, the normal stuff. You washing your face, you changing your pillowcases, the normal things. A lot of people are like, I already did that. You hydrating. They're still dealing with it. Okay, we're trying to assess, is it a hormonal thing? Like, what is going on? Where's your acne? So we can kind of diagnose. If it's all up here, it might be like skin, like hair products. So anyway, but the Aerolase laser, great at killing bacteria in the skin, reducing inflammation, reducing redness, like bringing down, like when I say inflammation, I'm talking about these, inflamed, pimples, basically. So we're trying to kill that bacteria. No downtime with it. I will see you twice a month for 2 to 3 months. After that, the people I say, okay, they start coming like every 3 to 4 weeks if they need to keep coming. But they can tell by that time, they're like, those are the ones. They're like, yeah, I don't have to try to cover this up. I've never not had acne. My breakouts, if they're coming, are like, instead of me getting this whole thing, I got like 1. I got maybe 2, maybe. And they're like, they speed up quick. We just zap it again, boop, and it's gone. The chemical peel, the BioRePeel is really great for it as well. No downtime with that. Sometimes we'll stack these, or sometimes we're doing separate. Only if I've seen here and there, I have like really, really severe cases of acne. We might see them weekly if they're trying to go aggressive, but really 2 weeks is good. Like I said, for 2 to 3 months, and then they start kicking back. Other things that we do in addition to the laser and the chemical peel, we talk about your regimen at home. So we got, like, we can prescribe and dispense prescription medication. So sometimes it's clindamycin, sometimes it's spironolactone, depending on what you are open to doing, what you want to do. We'll get you on a really good benzol wash. So like, we're really working on that. We got a black derm nurse practitioner on our team as well, Niani. This girl, I'm injector first, guys. She's skin first. Like, I love, like, skin needs to be first, period. I love it. But she's like a dermatologist. Like, she's a dermatology girl. This is what she does. This is all she does. She's like, like the aesthetic part of what we do in my job as a dermatology nurse practitioner is just a portion of what I do. She's doing like skin cancer. She's doing all the things. So I'm like, come see her. She's excellent. We get the skin right. She's really cool. And I just love her. Downtime after fillers, natural. I will have to travel to you. Hey, Brenda. So the natural filler, the one made from your blood, we spin it. We take out your growth factors, your stem cells. We inject it. I wish I could pull up my photos. But wherever we inject it, it'll make new collagen. It's going to look overfilled and swollen and puffy for 3 to 5 days. After that, it goes down. This is not temperamental. The way regular filler is, like, that's like, oh, okay, you gotta kind of be chill. Give me 2 to 3 weeks. It might swell up and down, da 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 da. You'll see the little bumps. It'll settle. Like, traditional filler is a little bit more, you gotta like be a little more mindful. You have to like a little bit more hand holding, a little bit more like these bumps are normal. They're trying to show them it'll settle. The natural filler from your blood, 3 to 5 days, and then they're like, oh yeah, it looks good. Like, you might be bruised a little longer if you can just bruise, but we try to tell you beforehand, avoid blood thinners, avoid alcohol, take arnica. This is why we do the calls before, so we can prep you and you can start prepping before you do the treatments. But 3 to 5 days, and then people are like, I'm chill, like, it's fine. So I've done it. Gosh, I feel like I could do it anytime, but like, it looks a little puffy, it looks a little overdone. 3 to 5 days, you're cool. Okay, let me see. Hey, honey hearts. Let me see if I missed anything. I'm trying to go up and then go back down. If I have nasolabial folds, should I fill them directly? Possibly. But I talked about smile lines earlier. So nasolabial folds, guys, are these smile lines. A few things. Don't try to get them all the way gone. We're still going to have the lines because we're still going to be moving our faces. It's not going to go all the way away. We don't want it to go all the way away, or it could look puffy. You just don't want to do that. So be mindful there. Other things are, you don't want to just treat this if you have sunken here. So I was telling earlier, gosh, that looks bad. If you got volume loss here and you only treat these, but you're not treating through your mid face and this is already sunken, because these smile lines are happening when fat pads start separating and sinking. So if you don't pay attention through this area, whether it's your temples, your cheeks, and you just do the lines, you're going to have a puffed out line, but then sunken cheeks, it's going to look weird. So you don't want that. We really, when we're doing something, guys, we got to consider the full face. We're not spot treating in our office. So I tell people all the time, not here, love this woman. She knows, she came. She's like, lips. And I was like, okay, I can't just do your lips. It's not just lips. What about the corners? This doesn't look right. If you got juicy lips with like downwards corners and then your chin is set back, like, no, it doesn't look right. If your lips overpower the lower face. And like, what about these lines and this line and this? So then we talked about it. And you don't have to do these things, guys. Like, I tell people all the time, like, you don't have to. And if I ever say anything, I'm like, never ever in my heart is it to like make anybody feel bad. Like, I'm always like, if you don't care about this, like, ignore me. You can tell me to be quiet. Like, that's never my thing. But I am trying to tell you about what I know, how the face ages underneath the skin. A lot of people will just say, this line happened overnight. But I'm like, no. Here's what's going on. When we pull all the layers back, here's where we're losing bone. Here's where we're losing muscle. Here's where we're losing fat. And this is how we approach it. So it looks natural and still looks like you. And it doesn't look puffed out and weird. It might just look puffed out and weird if you only do your smile lines and everything else around it is sunken. So that's something. Does masseter Botox make marionette lines worse? It should not. Botox in your masseter is really good for clenching, headaches, teeth grinding, jaw pain, TMJ symptoms. We also might do your temporalis muscles if you have pain up here. Both of these are muscles of mastication, chewing muscles. Sometimes we're treating both. This can slim the lower face. I just tell people, like, don't try to over slim it. Don't try to, it can slim the lower face if your lower face is wide from overuse of this muscle. If this muscle is like constantly bulking and flexing, that's when people will start to notice their face looks a little bit wide and more square. So when we relax it, Botox relaxes the muscle over time, a couple months in, when they're not bulking up all the time, that muscle, like they're like, hey, my face looks a little more slim. It looks more V-shaped because they're not overusing it. Okay, when I first got PRP, I liked the puffy look when I got it. Then it looked more normal. Lila. Okay, so yes, so you liked it. So when I tell people about this, because sometimes people will comment on my page like, PRF doesn't work, easy gel, that didn't do anything. I'm like, guys, like, I don't think your provider educated you the right way. It's not, because like, it looked good for 2 weeks and then it was nothing. I'm like, your provider didn't do enough education. We're not really chasing that 2-week swell that we see immediately with the natural filler. I'm like, that is, some people like it because they look a little filled out. I'm like, I'm not banking on that because I know it's not going to stay. I tell the patient, I'm like, it's not going to stay like this. You could like it, or you might think like, oh, this looks crazy. I'm like, but either way, it's not going to stay. It's going to go down. And you might be like, I didn't do anything. Guys, the whole purpose of this is to make new collagen over time. Your body to make new collagen wherever we placed it. It can take up to 6 months for your body to make new collagen. So I'm like, yes, it takes 2-3 treatments. It works, but your body's making new collagen. I was one of those people that I did it and I was like, I don't see any change. This is stupid. This didn't do anything. Because I'm used to the instant effect of filler. I'm used to like, I put the filler in, I see it go up and it's good. But with the natural filler, you put it in, you see it go up, and then in like a couple weeks it goes down. You're like, what happened? It gets better over time, guys. This is new collagen over time. So I've not had filler for 3 years because I'm breastfeeding a 2-year-old and I was pregnant, how long were we pregnant for? 10 months. Like, we're pregnant forever. And then I'm breastfeeding the baby. I've not had any filler. And I'm like, I don't have that picture set up anymore, but I was showing you guys earlier my haggard photo. Not haggard, but I had no volume in my face after breastfeeding my first one. I'm trying to see if I can find a photo of it. I don't think I can. I don't have it set up. Oh, here we go. Yeah, there we go. This was before treatment. This was me 10 years ago. And so I don't look like that. And I haven't had stuff in 3 years. I haven't had filler in 3 years because I'm breastfeeding. But I've been doing that natural filler. Over time, I was like, dang, I don't look so sunken. I'm 10 years older than this. I've breastfed 3 babies and I breastfed them all for 2 to 2.5 years. And I know when I breastfeed, I look sunken. Like on my number 1 and my number 2, I'm like, dang, can these babies get off of me? Because I'm like hollow. Like I feel self-conscious about it because I'm like, I'm tall and I'm like, I have a thinner frame and then my face looks sunken. I'm like, I look skeletal. Like this looks weird. I don't, and you know what I'm saying? But like, I don't feel like it this time because I've been doing the natural filler. So just remember, the natural filler is you're banking for your future self, new collagen. The younger and healthier you are, the better the outcome. Hey, Londa, I hope you're doing so good. Younger and healthier you are, the better the outcome. I tell people, have a healthy lifestyle. You want your body to have a good environment to make new collagen. If you're smoking, drinking, having a horrible diet, all those things, I'm like, your body's not going to have like the best environment to make new collagen. If you want an instant result, and this is not the instant result, this is the long-term result. If you want instant result, that's where we're going with filler. So yeah, okay. Let me see if okay. Londa, I hope you're doing so good. So basically, it's the long game for the fillers. Yes, so yeah, long-term game with this one. I mean, I don't like saying this, guys, because I love Botox and I love filler, but like, I don't know if I'm gonna go back for fillers. Like maybe one day, but I've been doing that natural filler, like in all the spots that I would typically do filler. Maybe I'll put a little drop there, Like these are tiny little shadows that people are probably like, what are you talking about? But I'm trying to just soften the little shadows where I know the face is aging. I've been popping in, do the blood draw, have one of my girls blood draw me up. Hey, can you hit me? Can you hit me there? And I know over time, I'm like, oh, it just looks a little bit better. Like I was getting more like chinny and I was like, oh, I need to hit this up. I did that maybe 3 months ago. It gets better. My temples were looking really sunken. I did that probably 9-10 a year ago. It gets better over time. It is gradual. It's a long-term game. So I tell people, I'm like, in your 20s and 30s, like if you're not really seeing too much, I'm like, I would go that way and start and like kind of stay. I'm not talking bad about fillers because I love fillers. You just got to see somebody that knows what they're doing, because if they're just injecting willy-nilly, like it's going to look bad. Again, I love fillers. I do it all day on the patients. I'm gonna get them freaking excellent results, period. And my team will. But also, there's a lot more that comes with filler. Are you the right candidate? Okay, you're gonna feel the little bumps. They're gonna come down. Like, there's more hand-holding, more talking with it. This one, I'm like, you're gonna put this in there. It's gonna get better over time. This is not instant. Don't talk to me about instant. And I know it works because the patients come back. They're like, I didn't see anything, Ginille. They'll come back for like their second one. I'm like, I know. Give it some time. Then I won't see them. Then they come back 6 months later, 9 months later. I'm like, why are you back? What are you doing? They're like, oh, I loved it. Oh, I can see it. Like, I want more. Like a year later, like, I want to do that again. I want to keep doing it. I'm like, yeah, I know. It just takes time. So it's something to keep in mind. Long-term game. Zara, God bless you. You're so beautiful. Thank you. Okay. Over the years, my face is getting wider. What can I do about that? If it's here, we can talk about Botox. Is it more low? If you're low, noticing like getting lower here, sometimes we do a little filler through here. If it's usually the face will start out like more wide up top, and then as we get older, it gets wide at the bottom. So this gets a little bit wide. This looks a little bit deep, like here. And so let me see if I can. I gotta scroll all the way back. Sorry. That's when we'll start trying to like use these fillers to make things look lifted. So here's one. So Gia just turned 50, but this was like early, like a year ago. So we did some through here and here to make it look pulled up. We softened here. We did some into her chin to camouflage those jowls. So that's a full face. I have another lady. These are just some of the ones that I've like screenshotted before I come on here. She was in her 60s. She felt like more. She was like, everything is kind of down. So we did filler laterally up to kind of make the highlight look up. Not instead of the highlight being down here, we're trying to make it pulled back. We just lose volume, guys. It just happens. We lose bone. So these are the things that we're doing. I kind of got to look at the face though. If it's wide, I got to know your age. I got to talk to you basically. But if it's wide from your masseters, overuse of the muscles, that's when we're talking about doing some hearts. So thank you. Some Botox maybe. So we just got to talk it all through. Hey Kiki, I hope you're doing well. Yes, in LA, and it's like raining all the way. I like the rain. Some people are like, what the heck? But we still got clinic running today. Okay, what do you think about microneedling and PRP? I think it's great. We do it in our office. We do microneedling with and without PRP. I think instead of just topical PRP, like that's cool. It'll help make the healing a little bit faster. I think really inject the PRF that is heated, the gel. You're going to see way better results for that. You're going to see, and so a lot of our patients are coming in. They'll do the same day, the laser, the peel, the microneedling, all on the same day, and the natural filler. So they're working on the skin, and then they're working with that natural filler on like volume replacement and collagen stimulation. When we're injecting that natural filler, the most common areas people will come in, their eyes and smile lines, but we can do the whole face. I have done people's full faces. I've done my full face with it. Temples, eyes, lateral part, here, your cheeks, the smile lines, the corners of the mouth, the chin, the here along the jawline. I've had some people do their lips. I'm like, it's not going to give you like that quick overnight instant juicy lip and like really defined borders. It's not that, but it can help give a subtle volume, like helps improve some of the texture over time. So just know, somebody said it earlier, it's a long-term game. It's a long-term game with that one. It's a future investment. Okay. Let me see if Saturday say over the years my face again. We talked about that one. You inspired Lila. I'm like, I think you will like it. I wouldn't be this hyped about it if I hadn't done it. Like God put me in the position where I couldn't do fillers. He kept having that baby, and like my husband's like, no, you don't need to be doing stuff when like you're breastfeeding. That's not good. And I'm like, yeah, I get it. But so I've been doing the natural one. Because honestly, if I just did the natural one time, I'd be like, this didn't do nothing. Give me some filler. Hand me the syringe. I just couldn't do it because of breastfeeding. So I kept doing the natural one, and I'm like, dang, I don't look so haggard. Like I should be looking like that other photo when I was 28, when I'm sunken. So just know it's that. I don't think enough providers are educating the patients correctly on it. And they're saying, oh, this can be your instant. I'm like, it's not the instant. It's not, I don't care about the 2 weeks. It's gonna look cute, if you're a little swollen and you like it, but it's not that. It's a long-term game. I live in and highly interested in your booking process. Set up a virtual consult. Yes. So if you do it at the top of my page, we just switched new EMR, new website, electronic medical records, new website. But if you go on, if anything is like not working, can you guys send me a message and be like, girl, this didn't work? I think somebody went on it earlier and they said it was, they jumped in there. But if you go on there, you can hit the virtual consult and we can set up the time to talk. Virtual consults, we're going to go through your questions, your goals, tips on what to expect, how to prep for treatments. We basically build out that treatment plan right then and there. I've been doing these virtual consults since like shutdown, guys, since 2020. So I'm like, really good at doing it. It's like I can get a pretty solid consult in there and know a treatment plan, and like it is very consistent with what I'll see in person. Obviously in person, I want to feel on you. It's going to be a little bit, but for the most part, the ranges that I say, like all that stuff, like from just us talking and me being able to see your face and animate, if you can be in good light. Sometimes people are like in the dark. I'm like, I can't see you. But if I can see your face and I can ask all the questions, and sometimes I'm like, hey, you know, I need you to go and send me a picture like in this angle because your lighting is not that great, or get to a better light. But yeah, the consults are so good and the patients come in and they're ready. It's not like them walking in and hearing the information for the first time. Because after we finish the consult, we send you a write-up of, hey, here's what we discussed. Here's what the treatment plan is. Here's like the estimated pricing. Hey, if you want to do financing, we've got that. You can pre-qualify before you come in. Hey, based on this, you told me that you've got this event upcoming in this many weeks. So this is how, or this many months or years or whatever. So this is how we're going to start. Here's your timeline. For people that are coming out of town, which is on a daily basis that we're in clinic, we say, okay, I'm going to see you in this month. I'm going to see you in 2 months or 3 months more. And then we're going to fine tune if we need to. So are you able to come back? If they're like, I can't come back, I'm like, okay, I'm trying my very, 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 very best to get you that perfect result in one session. However, if you can come back, if I need to fine tune anything, I want to be able to see you back. It takes 6 to 8 weeks to fully settle. But yeah, we can do our consults and it works really well. And the consults are $150. The price, people are like, oh, what is that? I'm like, the price goes towards your treatment. Uh-oh. It says I've been talking too long. The price goes towards your treatment if we do treatment within 3 months. So that's nice. You can do an in-person consult, but it's just harder because sometimes they're like, oh, I didn't know I got a bruise. Oh, I didn't know it was going to be that money. Oh, whatever. Oh, my event is here. Oh, I was drinking last night. I didn't know. So then they're not ready. And I'm like, this is not good for you. Like, you give us the time to prep. Oh, I didn't know that I should have taken that, arnica, that pineapple that you were telling me, and that would have helped my outcomes, all the things. Mystic, thank you. You're so beautiful. God bless you. Okay. Let me see if there's other ones that I'm missing. Best procedure for skin whitening, brightening, sunscreen. And then that's going to help with hyperpigmentation or dark spots. The laser is wonderful. I really think the chemical peel is the best for like brightening. I love it. I already take really great care of my skin because I've been in this for a long time. But when I did that chemical peel, I was like, whoa, how I see like a visible difference, like with one treatment. The patients love it. Our team loves it. Safe for all skin types, all skin tones, no downtime. The Aerolase laser has no downtime. The chemical peel has no downtime. The hydrofacial has no downtime. The skin pin microneedling has very minimal downtime. Where did you get the chemical peel? We do it in our office. It's BioRePeel is the one that we do, and it's excellent. You want to do a series of them. The company says to do them weekly. I think weekly is a little aggressive. When I was doing them weekly, because it's still active, it was getting like a little too dry, and then I was like getting flaky, and I didn't like that. So we have found when patients are doing like every 2 weeks, it's nice. They don't get super dry. They're not getting a little itchy. And then we can combine that peel depending on your concerns. If it's acne, we might be combining it with the Aerolase laser. That works really good for acne. If it is like scarring, we might be doing that with the microneedling. If it is just like hydration and like deep cleansing of the pores, we're combining it with the hydrofacial. So very versatile, safe for all skin types and tones, no downtime with it. I think I want to do it this weekend because it's just like raining out. I'm like, what can I do? I don't know, but I really love it. But my husband loves it too, and he says he can never see a change. But he was like, can we do that thing again? I was like, yeah, I thought so. Does it hurt? No, it doesn't hurt. It takes like 2 minutes to apply it, and then you leave it on for, it might feel like slightly tingly. I'm like, I don't want it to be more than a level 3 out of 10, but like when I first did it, I was like, I don't even feel anything. I'm like, is it doing anything? Again, I was like, there's so much gimmicks in this industry, guys. I'm always like, this is not like, I don't want to believe nothing. I don't think anything works for black and brown skin. Like, I'm very like, I don't believe anything because I've been in it a long time. I've been in this industry since 2013. I've heard all this stuff. Some people will hype it up and then it can come down. You don't do it yourself. We do it in the office. We do want to analyze your skin when we're doing this and make sure that your skin is reacting normal. But everybody has tolerated this really well. Yeah, I can do it myself, or I'll have one of my team members do it if I need. But the BioRePeel is excellent. We can do it on the body. I know somebody was like, what's the price for the full body? I was like, dang, I gotta see the size of your body, but you can do it. You can do it everywhere. Somebody was asking, can you do it on the hands? I said, yes, as long as you're wearing sunscreen. Really good for acne and acne. That works really well for pigment. On the body, we do a higher percentage though, just because the skin is like thicker. Hey Bubbles, you said, what are we talking about? We're talking about the BioRePeel chemical peel. So really great for brightening, really great for acne, overall skin rejuvenation, fine lines, textures, just the skin looking great. And I was saying you can also combine that the same day with microneedling, with hydrofacial, with the laser, depending on what your concerns are. So most of our patients are doing multiple in one day. Okay, where are we located? In Los Angeles, we've got Mar Vista and Torrance, and then in Las Vegas, we're on the Summerlin side. So I was in Vegas yesterday seeing patients. We had a great day, and I'm back in LA. And okay, let me see if I'm missing any. I think I got all the questions. If you have others, let me know. I can talk through more patient before and afters. She came in, felt like she looked tired, and she wanted to camouflage her under eye bags. She didn't get puffy underneath her eyes. She doesn't cry. She doesn't have bad allergies. She doesn't retain water underneath the eyes. And so we did filler to camouflage that fat pad. If you want that fat pad taken out, I say, hey, go get a surgical consult. They can take it out or tighten it. I've had some people do that and they still come back and they're like, okay, they got rid of the fat pad, but now I'm still sunken. So that's why that's when we might do filler or the natural filler for hollowness, for sunkenness. She came in beautiful. She seemed similar thing, trying to camouflage that fat pad. We all have this fat pad underneath our eyes, guys. Some people sticks out more or protrudes down more than others. As we get older, it'll start to bulge forward and come down. We were trying to camouflage it. We did some filler there. She wanted her Cupid's bow, the little like part on the lip, a little bit more defined and wanted more fullness. And then this is so subtle, but she was like, I have this little dip in my chin and her chin was more square and she wanted to make it more heart shaped. So beautiful. And I have like different views of her and her after selfies. Hot, beautiful girl. What about PRF? Oh yeah, PRF is excellent. You can do the same thing in those areas. Bubbles, you jumped off, but I was saying, we were talking earlier, me and Lila were talking about PRF is a long-term game, not the instant result. This one is going to make new collagen over time when we're doing that natural filler. We don't just take the PRF, but we're heating it and cooling it so it makes a gel, and your body holds those growth factors and stem cells in the skin longer when you heat it and cool it. And so your body has a better chance of making new collagen than regular PRF without heating it and cooling it. It kind of, you go through it in a few weeks. Okay, how often am I in Vegas? Is it hard to get booked with you? I'm in Vegas like once or twice a month. And other than that, we have our team there and they're excellent, excellent, excellent. But I will go out there and I'll see people for like full facial balancing. But our team is there and seeing patients. They're doing skin treatments. They're doing Botox, the filler, the natural filler when I'm not there. But yeah, I was there yesterday. And let me see. I'm local and want to do an in-person consultation. Will it be with you? Charlotte, you can totally do that. If you call or text the team, the number, they'll help you with getting set up for in-person. Again, I tell people, like, if you're going to just come in person, we still will try to make sure it's like good timing for you. We try to make sure that you prep in case, because a lot of people are like, I want to do it today. So I'm like, oh, did you know you can brew? So we just still want to make sure it's good timing for you and give you like information. So we will probably at least be like, can you send me a couple photos? Or, you know, here's pre-care and post-care. Review this in case you want to do treatment. Because a lot of people, once they're like, I want to do it. So I'm like, okay, but you want to make sure the timing is right and that you're a good candidate for it. Okay, do I do telephone consults? Because I like a recommendation of what you think. Yes, I do the virtual consults. We can do like this on the camera, or if you don't have like access to the camera, you can send me pictures and then we can do the talking through there. Okay, let me see. PRF, we talked about that one, is so great. Aftercare for the aftercare, I think you're asking about when we were talking the chemical peel. You just have to like stay out of the sun. Don't use your active ingredients that day. Don't scrub at the skin, but you're good. That when you get back to life. I'm pretty sure that's what you're asking me. Okay, let me flip through some more photos. Noses. Here, you know, we can camouflage a bump. We can lift the tip of the nose. So here's camouflaging a bump. We can create a highlight down the center, just making things look like more refined. All of this is done without surgery. Yes, you're welcome. Here is oh, again, we see boys and girls. We see everybody. He came in. We've done a lot of treatments. I love him, and he like will share his journey, and we make videos. So we have more photos of him, but for this, we had done some Botox. So if you look at the lines on the forehead, they're softer. We did some filler underneath his eyes. We've done laser treatments. We've done the hair health program. Dang, have we talked about hair today? No, I don't think so. So the hair health program is where we're trying to, he came in and he has really good, dang, do I have those photos? I'm going to see if I have it. I'm going to scroll. He was noticing just some hair loss, and he's like, this is my dad around this age. He was losing hair in the same area. Trying to scroll and see if I can find him. And we did the scalp facial. So we're trying to clean out these hair follicles, making sure nothing is blocking them so that they can actually grow, sweat, any debris, any products. And then we did, dang, I don't have them on here. I have like hundreds of thousands of photos on my phone. And if I don't set them up beforehand, I can't like click through them really quick. And then right after, and so we do red light therapy, we do a scalp massage. It's like a very relaxing thing. And then right after, we are drawing his blood. We do the similar process where we're spinning it in the centrifuge. We take it out and then we inject it. Wherever we inject it, it's stimulating those hair follicles to grow with the PRF. And his before and afters, I'll usually have them. They're just so great. Like, he was like, my barber is like, what are you doing? He's like, he could totally tell. And he's like, I used to be getting haircuts every 2 weeks. He's like, my barber is like telling me to come in weekly. He's like, what is going on? So yeah, the hair works. Can I show the nose ones again? Yes, I have a few noses. We have like way more photos, guys, but these are just some that I've snapped on my phone to set up so I can click through them. So she had a little bump and she wanted her tip turned upwards. And some people want it turned up. Some people want it straight. She has a bump on her nose. She wanted it to be straightened out. Let me go through. The highlight down the center, I tell them, like, if you have a really wide nose, I can't make your nose super pinched in. However, we can create this highlight here, kind of build up the bridge so light hits off the nose a little bit better and it can look a little thinner, but it's not actually pulling you in. We can also do things to the nostrils. Some people be like, this nostril, this triangle, this one is round. I want them round, or I want them triangle. So we can do that. I've done a lot of people after nose surgery and they're still like, oh, this nose surgery, but I still got this over here. Like, this, what's going on? So I've done a lot of those. When she smiled, her nose turned downwards and she wanted to turn upwards instead. So we did a little filler there. She had a little bump and she's like, I just want it all the way straight. And I want the tip to look face upwards. When I smile, I have a little bump and my nose curves down. I want it to be straight. So all of these are like instant. Like, you can see the nose filler like right then and there, which is so cool. We did 3 sessions. I usually do 2 sessions. I do some. I say, come back in 6 to 8 weeks. Let me build on the foundation. She did 3. She was like, I want it so straight. My family's not going to let me do a nose job. And this has lasted her so long. Best for wide noses. Hold on. Or when you smile, it looks wide. If it is your nostrils flare, you can do Botox to minimize the flaring. Maybe, like I said, like a little bit of highlight down the center, like building up the bridge. But if it's like really wide, one time I had somebody on here and the nose was like really full. I'm like, I don't know if it's going to do much at that point. Maybe a surgical consult, like if the nose is really, really full. How do you book a consult? I don't see it on the website. Okay. Dang, then I got to check that link. So at I don't know if you're at JASISkin.com or if you're under my name, but the link at the top of my page, if you click that, it should take you to the booking and it should say virtual consult. If not, Bubbles, I just updated this link yesterday because we just made a new website and changed the name and everything this week. If not, the number at the top of my page, 424-218-4023. If you text them, my team is on and they get the text. They're like, Ginille, somebody's talking to you on TikTok. You sent your pictures. You said you look at them. Like, you can text the team and they'll help you with setting up the consult if you don't see it on there. So I'm really sorry, but we did just update that. Okay. Oh, she said she found it. Okay. That makes me feel happy that it's there. because like I said, we just updated that. Okay, Soggy Dogs, I'm gonna book with you soon. Thanks, I can't wait to see you. I like that name. It is gonna be Soggy Dogs outside today. Yeah, so in the office, guys, all skin types, all skin tones. We see everybody. We're gonna make sure it looks natural, never overdone. We build out a treatment plan. It's a lot of talking. As you hear me yapping and yapping, it's a lot of talking because we want to make sure that any of these treatments are going to fit you and your lifestyle and your goals. So we ask a lot of questions. We do a lot of patient education. Guys, I've been talking about the same stuff for 5 years, but I really want you to make informed decisions, not rush decisions when it comes to your face. And I'm praying all day, and the team is praying all day. We want you to get like the best outcomes and feel confident and beautiful and like not rushed and not weird looking and not overdone. Now, there's stuff that I'm like, I'll tell you, I'm like, it's going to look weird in these first few days. It's going to look weird. It's going to look puffy. It's going to look like you got it overdone. You're probably going to be nervous. It's not going to stay that way. I'm like, I've seen this. I've been doing this since 2013. This is all I do. I'm a team. This is all I do though. And I just, that is what God's gift to me was. And I still, sometimes I'm like, I don't know why this was the gift, but thank you for it. And I'm going to do my very best in getting great outcomes for people and helping them look and feel fresh. So she came in and she just felt like she looked tired underneath her eyes. She wanted lips, but I was like, hey, we can't just do lips if your lips are going to dominate and go protrude past your chin. So we did some lips, but we also did some filler into her chin to bring her chin forward, help to like showcase the lips better. And then some filler underneath her eyes and into the cheek to camouflage that fat pad and make the cheeks look lifted. So yeah, still looks great, still looks hot. Here, like if you see her walking down the street, you didn't think she did filler? Nope. You wouldn't think that. She just looks natural. Looks like she was born that way. That's the whole goal and the whole point when we're doing it, not to look overdone. She wanted her jawline. She's like, I want you to define this, define this, define this. I was like, look, I don't really think it's good. Like, your jaw is pretty cool. Like, we can do that. But before we do that, I was like, I think the biggest impact is going to be if I work on this chin and this lower face area. When we do chin filler, guys, I tell people, let me see if I have some photos. I'm like, it's not just filler right here. Oh gosh, I see it when I'm walking around the street. I'm like, why do people just have filler like right there? Their freaking injector didn't finish the job. You can't just put filler right here. You gotta blend it through. So we gotta make sure it connects to the jawline. So if I just did her filler here, it'd be cool. It'd be like, she'd get the forward projection. And here's her like from the side. You know, she'd get the projection, but this little, we call it pre-jowl sulcus. This little area here would have been dipped in even more. And these lines would have looked sad. It's not gonna work. I'm like, guys, we gotta think about the full picture. I can't just do it here. I gotta 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 blend it through. If I don't blend it through, it's gonna look bad. It's gonna look like you got work done. It's gonna look like you got work done because it looks bad. Because people are leaving people out here unfinished or overfilled. We don't want that. I just want to look seamless and harmless. You wouldn't think she's had filling. You walk past her on the street, you're just gonna think, oh, she's beautiful. Wow, what does she do? What does she take? What's her makeup routine? What's her skin routine? That's the whole point. Wow, what's her routine? She's so pretty. Is she a model? That's what you're gonna think. That's the goal. It's still gonna look like you. It's gonna look fresh. You would not think this girl has done stuff. That's the point when we do it. Sorry, I'm just getting mad sometimes. Okay. What about the theory? You can go blind. I've been nervous to try nose filler. Okay, so safety with filler. When we do filler anywhere in the face, period, I tell people, I'm like, think about the whole face. The whole body has blood vessels running through it. When I'm injecting, my team is injecting, and what we're doing the whole time we're injecting is trying to make sure we don't block off blood flow. So we're looking for your skin color to be normal. Shouldn't be paler than normal. You shouldn't have extreme pain. You shouldn't have any vision issues. If you had any of those signs, and we tell you this before we do it, it could mean somehow we're blocking off blood flow. At that point, we would need to dissolve the filler. As long as I have been doing this, guys, since 2013, and this is all I do faces. I've never had to dissolve anybody for any emergent reason, any part of their face, any filler. So it's super rare, but this can happen. And so, yeah, do we stay stacked of dissolver? We got so many vials on hand. Do we have a whole emergency kit? We've got a whole machine to bring oxygen to your skin in case of emergency. Yes, I buy all this stuff to have. Yes, it expires, and then I got to get another one because we don't have to use it because it's really rare, but we want to be careful. We want to know what to look for, things we're looking for. I'm like, when I'm doing this, I want to make sure your skin color is normal, not pale. See how that's like kind of yellow when I press down? It's like even on brown skin, you can see it'll be paler And like, I need to see that the skin goes back to normal, not stays pale. If it stays pale, that's showing me when I'm injecting your face that blood is not moving to the area. So when I'm doing it, I'm like cleaning you. I'm doing multiple things. I'm cleaning you because we don't want dirty, you know, we don't want to be touching the face and you're touching the ice pack, and I don't want bacteria in the skin. So I'm cleaning you, and then I'm pressing and I'm looking at that blood flow return. My team is too. And we got a whole other person over there tapping your shoulder. They're also looking. They're asking, how you okay? You doing all right? You doing all right? The whole time as we're going. Again, super rare. Never had to do any emergent intervention, any part of the face. We just want to be careful. Now, when it comes to the nose specifically, and people are like, oh my gosh, don't get nose filler. You're going to go blind. You're going to go blind. I'm like, guys, like, it's not like that. Like, stop. Okay. The blood vessels behind the nose do run to the eyes. So if you do block off blood flow in the nose, you could block off behind the eyes. Again, super rare. Another reason why when I do filler in the nose, I tell people, let me give me 2 sessions. I need to see you back. I don't want to just try to fill. Also, any part of the face, I tell everybody, give me 6 to 8 weeks, let this settle and reassess. As we're injecting, I'm poking you. Even if I put nothing in your face and I'm just poking you with a needle, you're going to swell and you're going to bruise. So now I'm poking you, I'm putting something in there, it's going to swell up. I'm going to have a false perception of the full result. So I need to let this settle. I need to see you back to reassess if we should do more. A lot of times people come back and girl's perfect. I don't need to, I'm so happy. I don't need to do anything. And that's what I want. However, in my mind and in your mind, I want the expectation to be like, if we need to, we can, just because I don't know if it's going to be a home run in one session. Like, your face didn't change overnight and age overnight in one day. Like, so I'm like, don't give me 10 minutes to do this. So that's how we approach it. Super rare. Make sure your provider knows what to look for, knows how to intervene, talks to you about what to expect with safety. And they have all this stuff. I've just been doing this a long time, guys. I went to Stanford. I went to Duke. Like, I'm not trying to play around with nothing. Like, I just want to be excellent at what I do. And hello, blessings. And thank you for the hearts. And like, get great results and safe results and have the patients looking fresh and like themselves. Okay, sorry, I'm talking. You guys know I can't answer one question in one word. Okay. Hi, Marie from Chicago. I hope you're doing so great. Oh, you're a nurse too. Nurses, we see so many nurses. You're probably doing the same thing. Okay. And I think it's so great. Okay. Thank you. Blessings. God bless you. Okay. If you have other questions, please let me know. With the BioRePeel, do you moisturize a lot after, or do you just let it be dry? We moisturize, but it's not like a super dry, peely. I mean, it's a little cold out right now if you're in LA. So maybe, but it's not like peeling. It's not sheet peeling. It's like a little bit lightly flaky, if anything, usually around here, around the mouth. We will have you moisturize. We apply our JASI Recovery Boost Serum. So that helps calm any inflammation, any redness, any dryness, flakiness. That is great to use after. I love that one. I'm like, you guys have been talking about it too much today. I think I need to go do it today. Looking forward to any treatments. God bless you. God bless you. Are you guys closed for Thanksgiving week? No, we are open. I just don't know the whole schedule. I mean, obviously Thanksgiving Day, we're closed. I don't know. Like, everybody has different schedules. So we have an amazing team of providers. It's not just me, guys, seeing patients. These girls are excellent. They're very skilled. We got the same philosophy, the same approach. What are these hearts? Thank you for that. I don't even know what this is. Thank you. So yeah, come people. I mean, a lot of people will come on the holidays. They're kind of like a lot of outside of LA people will come. Thank you guys for the hearts. I don't even know about the hearts, but I think it's so cool. Thank you so much. Appreciate you. Okay. If you think of questions, please, you can call or text the team, and I see all the messages that go through. You can set up the consult. We can do our virtual calls, go through your questions and goals, tips on what to expect, how to prep treatments, analyze your face, build out the treatment plan for you. And then obviously in person, we can do our treatments. At home, guys, if you're like, I'm never going to do any of these things she's talking about, I'm like, okay, that's so fine. I don't need you to do any of these. But at home, make sure you wash your face, sleep on your back, hydrate, drink water, and definitely use your sunscreen and reapply it. Tap the screen, like the live, get your heart me and follow. Ginille is awesome. Thank you, blessings. I appreciate you. Is that Sujia? Yes, that's Sujia. We've been working together for some years now, and She's wonderful. She's made videos talking about what she has done, and it's really cool. We've done filler in through her mid face, her cheeks to have the cheeks look more pulled up. We've softened smile lines. We've done the corners of her mouth, her chin, and along her jawline. And we've done her lips for a little fullness. And then we've done Botox. We've done laser, the chemical peel. We've done all the things. Like, she's so cool, and she talks about it. And it's really fun that she shares. And she just tries to highlight, these things can be done. It can look natural. It's safe for all skin types and tones. It doesn't have to look crazy. I think if you see her, you wouldn't think she's done a bunch of stuff. Like, that's the whole point. It looks like her, and that's the point. I want to look at you. I want to look fresh. She says she feels like the inside now matches the outside. She's like, before I felt like she said it way more than what I was. She's like, I feel like I look a whole old hag. She's like, who was this lady? She's like, my husband was like, was that you? But she's like, yeah. She's like, now I just feel like I look fresh, and that's the whole point. It looks like her, and we love it. Yeah, I don't see it as an option for a consult. So on there, so my in-person consults, the team will set up, I think. The virtual consults, it should be on there unless I have to add more times. If you don't see it, Charlotte, will you just text the number, and then it's 424-218-4023, and then they can help coordinate. Most of the time, because I'm already seeing patients that I know and have been treating for a long time, in-person consults, I do way less, because I would do the virtuals on the day that I'm not seeing patients, and I will like, hey, let's prep this. So then when you come in, you're like ready for treatment. Okay, let me see on there. Bubbles, God bless you. She's like, can't wait to see your picture up there. I can't wait to see you either. Okay, if you think of any, I've been trying to sleep on my back for 20 years and nothing works. Keisha, I know, it's hard, but if you're like sleeping on the side, you're gonna get these lines. Yeah. So I try to tell people, I'm like, if you can, it just helps. Definitely wash your face. I think that's one of the biggest things. That's just, to me, I'm like, oh, this is basic. But a lot of people are like, oh, I forget, or, oh, I forgot. That's a big, I forget. I don't drink that much of water. I'm like, this is internal too, guys. That's the biggest part. Okay. If you think of anything else, please let me know. I appreciate you for being on here. I will try to come on live again, because it's just like a rainy weekend, but I'm going to go check and see what's going on with my children. I appreciate you guys. The lady on the screen looks amazing and refreshed, and she's so cool. Thank you. Wash in the morning or the night, at least the night, take everything off. In the morning, if you're sleeping on your face, I would too. But at least at night, get everything off. I hear the little ones, they just got back. So thank you guys so much. I appreciate you. I will talk to you soon. Seriously, text the number or set up the consult on the top of my page. Office is in Los Angeles. So we've got Mar Vista, we've got Torrance, and then on the Summerlin side of Las Vegas. And so I'm Ginille, a cosmetic nurse practitioner. I've been treating faces since 2013, and skin and hair. Like, this is what I do. We specialize in natural looking aesthetic results for all skin types, all skin tones. I want to look like you, want to look fresh. We're going to make a treatment plan. All the treatments are going to be customized to you and what's going on in your lifestyle. Had Easy Gel. Oh, we talked about this, Lala. We talked about Easy Gel a lot earlier, because somebody else said the similar thing. They're like, I don't see anything after a week. Lala, for your provider, I don't think they did enough education with Easy Gel. We're not caring about the little lift that you see. I mean, it's cute, like the lift that you see immediately for 1 week. What the whole purpose of this is, your body is going to make new collagen wherever you injected it over time. It can take up to 6 months to see the full result. So this is an investment in your future self. This is not, hi, Justice Hearts. She's friends with my mommy. This is not just the immediate, result. So this is a long-term game. If you like the look when it was swollen, hi, Megan. What are all these hearts, guys? I don't even know what this is. If you like the look when it was swollen, it is done. That's more of a filler thing. That's like the immediate effect. But the natural filler is going to improve over time. So, okay, I don't even know what's going on with the hearts, but I appreciate you guys. Hey, girl. Hey, blessings. I appreciate you guys. Thank you so much. And so, Lala, you do want to do that second treatment. Retreat the same areas. We're trying to stack those growth factors. We have our patients come back a month later to retreat those same areas. If you're like in your 20s, early 30s, we say do 2 treatments. And if you don't have like that much volume loss, if you are like mid 30s plus, I say 3 treatments, retreat the same area. It will get better. It will. Trust me. We talked about this a lot earlier, but when I first did, I was like, this didn't work. Over time, I'm like, I don't look so haggard. And I have not had filler for 3 years. I don't even know if I'm going to go back to filler. I love filler, but The natural one works. It's just the long-term game. If you want to see that instant result, go with filler Lala, as long as you are a candidate for it in the area that you're treating. Oh my goodness. What is all of this? Thank you so much. I appreciate you and I love you. Hi. Hey girl. Hey Lala. Okay. If you think of anything, please let me know. And Winchell's in the UK, flying USA now. It wasn't a good idea. I know. Flying to the USA is not a good idea. Who is in the UK? Kate Goldie. She was one of the people that I learned about the natural filler from years before we had it in the US. And she's like an excellent researcher, so I would check her out. Follow. Thank you. Yes, if you think of anything, please let me know. I appreciate you guys. I'm going to go run and check on my children, and I will talk to you soon. You can always send me questions here, but really, just so I don't miss it, I don't know how we're getting all these hearts on here, but that is really fun. If I miss it, just text the team. They don't miss anything. They're like always on it, and I see those things there. Thank you, Justice, and thank you. Blessings. I will talk to you guys. I don't even know what all these hearts are. I never had all this. Thank you so much. I appreciate you guys. I got lipstick on my teeth. This is crazy. Okay, I will talk to you soon. I hope you have a good one. God bless you. I will talk to you guys later. Bye.